You're welcome. And we have Dr. Veronica Ayovon, Deputy Director, Medical Services and Disease Control. You're welcome.
Thank you.
I'm going to start with Oluwakemi, and I'd like her to give us an overview of what the Lagos State Integrated Vaccination Campaign is all about.
Okay, thank you. Thank you for the question. So the Lagos State Integrated SIA, that's Supplemental Immunization Activity, is about getting our children and adults vaccinated against vaccine-preventable diseases. And when I say vaccine-preventable diseases specifically, I mean measles, yellow fever, and for HPV for our girls. So we are integrating these services to catch up, for the HPV to catch up with girls that were not vaccinated last year when we introduced the HPV vaccine. Then for measles and yellow fever, that's for 0 to 59 months, that's for measles campaign. And then for yellow fever for 9 months to 44 years, and that's about 85% of the total population of Lagos State. We're looking at vaccinating about 22 million people with the yellow fever vaccine, about 4 million people with measles, 4 million children, 9 to 59 months with the measles vaccine. And then for our girls, 9 years to 14 years, those that were missed last year, the missed opportunities we had last year, are going to get vaccinated against HPV vaccine this year. So the activity is going to start on the 19th of October, which is next week Saturday. And we're looking at going into the houses, going into to the communities rather, to the schools, to our churches, the markets, to the offices, as well as LTV. Yes. We're going to be vaccinating your people. And then we also look at vaccinating in where else? Okay, so that's about it. Yes, we're going to be going into all the places to get these eligible people vaccinated against these vaccine-preventable diseases. And a healthy Lagos, sure, is very important to us.
Okay. We'll still have, with the level of exposure that we have today, there are still a lot of people who are hesitant about taking vaccines. I, encountered some people who were like, Kilonjebe, I can't take it. So I would like you to share some of the consequences of not taking these vaccines, especially for measles, yellow fever, and HPV.
So I know there is a lot of hesitancy, and which is rightly understandable, because again, you don't know what will happen until you take it. But like everything else, we've been taking vaccinations since time immemorial. I'm sure you took some when you were young, and you're still here, you're still alive.
Yeah.
And so that's why when we hear some of this myths and misconceptions, as we call them, it's good for us to address it, because again, these are vaccine preventable diseases like measles, and they have complications. Some of them, for instance, when you talk about even HPV and co, they already, when it helps you to not be able to get diseases in the future. So it's just a way of saying, okay, we're giving you a little so that your body works up a reaction before, if ever you actually get the main disease. And so if you do, your body is already, it's like your soldiers are prepped. They're ready. So if it comes, because that's the essence of having this vaccine, then of course your soldiers can easily, it's like, oh, I remember this. They get to work. Yes, they're very familiar with it. So now imagine when you don't have that. It's like when we took the COVID vaccine, right? So for those who had it and had their boosters, even if it came, it wasn't fatal. And therefore, your body is able to cope with this onslaught. But if you don't have it at all, then you're setting yourself up for God knows what, because it now depends on the level of your immunity to be able to fight this. And for children, their immunity is not built until they get over 5 years old. And so most times it's necessary for them, just like we say, you need to, when you deliver a baby, breastfeeding, because the baby gets the immunity from the breast milk of the mother. And so that helps the baby until about 6 months when the body starts to work up some kind of immunity. But it's still insufficient. And so until they get to 5 years, they have to continue with their immunization schedule. It's really to help them and to boost their immunity. So in terms of complications, it could run from just minor to very severe debilitating complications. And so the main thing is to make sure that you are prepped ahead, your body has worked up that immunity and can fight whatever comes up.
Okay. Kemi, when you were talking earlier, you mentioned the diseases they're trying to fight, measles, polio, yellow fever. And I noticed that you mentioned HPV for girls, yes, which wasn't prior 2022 when the integrated system was introduced. I'd like you to shed more light on the HPV for girls.
Okay, so for girls, 9 years to 14 years, yes.
Yeah.
So we're introducing to girls that are not sexually active. And because you know the HPV, like she said, like Dr. Iwayemi said, the HPV virus itself, we have like, the vaccine we have right now is supposed to combat like 4 strains of this HPV virus. So specifically, we have 2 strains that cause the HPV virus, the cervical cancer itself. So in future, when these girls are exposed to this HPV vaccine, the HPV virus rather, they do not come down with cervical cancer. It's just the way to prevent them when they get exposure. Your body has built natural defense, that's worked on the natural defense mechanisms, and at the end of the day, when you get exposed to this, so for vaccination all around, it's not like when you, like I would use measles for an example, you know that even after children get the measles vaccination, they could come down with measles. So, but for HPV, when you're vaccinated against the human papilloma virus, when you're exposed to the virus, you do not come down with cervical cancer. You might come down with some symptoms, but the cervical cancer that we're actually trying to combat, you do not come down with cervical cancer.
So what about women that are already, exposed to sexual?
So for women that are exposed to sexual activities already, you need to get a scan, you need to get a pap smear done, HPV, anything HPV screening before you can get the vaccine. So, and that's not available for the women at the primary healthcare centers. But after the screening, you can go get the vaccine.
Okay.
So I want you to speak on how the team will be mobilized. What will be the process of this?
Okay, so we have vaccinators. We are looking at using 4,218 vaccinators. We're also looking at using the same amounts of recorders. We are using crowd controllers. We're also using town announcers and community mobilizers. So we are looking at community mobilizers going into the community to mobilize people to strategic points where these vaccination posts have been situated rather. So we are looking at, we have megaphones to announce in the community to the community members about the activity. Although this is part of the sensitization we're doing now, sensitizing people of the activities that are coming up. We've been to several media houses. We've had several engagements. We had a webinar on Friday, and we've been able to sensitize a lot of people about this activity. So we expect that if they cannot, if they do not see our people in the community, they should go to the nearest health facility, tertiary facility, the nearest general hospital, the nearest primary health care facility to get vaccinated. We need to achieve herd immunity, where at least a lot of number of people for measles now, that's 95% of children 9 to 59 months are vaccinated against measles, and for those that are not vaccinated for one reason or the other, maybe due to illness. I mean, when we have herd immunity, it covers all those people, so that we know that a lot of people have been vaccinated, and at least in the community, we do not expect at least if 95% people are vaccinated, the remaining 5% that are not able to get this vaccine because of one reason or the other, maybe due to immunocompromised situations, at least they are not, they are covered. That's what I mean.
Okay, so I would like to ask, does this campaign, I hope it doesn't clash with the normal immunization process, especially for babies. You know, you take from birth, then 6 weeks, and I know measles is part of the, so is it like it's not excess or?
She has a baby. So she understands the routine process.
So trust me, I have a 4-year-old, so I know.
Okay.
No, it doesn't. Actually, even our routine immunization is included in this. And so we're going to be also working. The PHCs are not going to be shut down. Everything is still going to be going. Routine services will be going, apart from the fact that we're going to be in the communities. We're going to be, let's just say we're going to be in your face. And that's why we've been appealing to a lot of even the banks, because we're going to be going to the banks. It's wherever we have huge congregation of people, because we're set to immunize over 21 million Lagosians. And so to do that, we have to go to mass places where there are huge crowds. So we've gone to the banks, we're going to be going to companies, so we would like them to give us access to their staff. And that's why we're here, to answer any questions, to help in debunking so many rumors so that people feel comfortable. It's necessary to understand that vaccination is voluntary. It's not like we're going to force you. But see, there's a saying, my people die for lack of knowledge. We need to understand why we need these vaccines, and we need to understand what it does in our system so that we're able to make informed decisions. And that's what we're asking our people to do. Make informed decisions, avail yourself, especially if you're a caregiver. The baby with you cannot make decisions, and that's why as a caregiver, we're appealing to you so that we can give you the information you require to make that decision to protect the future of Nigeria, to protect your child.
Okay.
In addition?
Yes.
So in addition to what Dr. Waimi has said, if your child has been vaccinated for measles or against yellow fever, irrespective of your child's immunization status, the child is still supposed to get this, yes. Okay. And if your child is due, as that's when the campaign is on, let your child get, as far as that child is within that age range, let the child get vaccinated. Then, after 29 days, you can go for your routine appointments.
Okay.
And if I could say something, you know, we're giving yellow fever as well, because I know some people might be thinking, oh, I've already gotten vaccinated for yellow fever. You can still take this.
Okay.
Yes, you can still take it. So adults, you can walk into the PHCs, but for the children, because we know they're not going to walk on their own, we're going to the schools, we're appealing to the schools, particularly even gated estates, to please ensure they allow us access to be able to come into the community and provide this service that is free of charge.
So for some schools, you will need consent forms from parents. So how are you going about that too?
So consent form has been designed and sent to the LGs, and I think I've seen on social media, yes, where people are posting the consent forms. So consent forms have been sent out to schools. We're expecting feedback from parents like you.
Okay. I need a clarification on, you know, when you say integration, vaccines for diseases like measles, yellow fever, HPV, and COVID-19. Are they coming together? No. It's not. It's okay.
When we say integrated, you know, when you have polio campaigns, you have a standalone program. That's a standalone. So when it is integrated, it means that you're bringing different antigens together to get these children and the adults vaccinated. So that's what the integration is about.
Is it one vaccine? Or does,
no, it's a single antigen pad.
Okay,
yes,
okay,
yes.
Okay. You said something earlier about community involvement. For those who prefer to have their children or have their kids at this traditional, this alternative medicine or medical practice,
TBAs,
yes. How does this work for them?
Okay, so for us, we also do integrated services at the LGA level. The TBAs are trained, yes, on reproductive health.
Okay.
And when they are not able to manage a particular case, they are told to, they've been informed to refer. So we also go to, during outreaches, we also use our TBA centers as outreach points for immunization. So when they have children or babies, they call on us, we go there and we vaccinate for BCG, that's yes, and then for HBV that the child is meant to have, and OPV 0 that that child is meant to have before the child is referred to the health center. Because we need to integrate them. There's no how. We cannot stop people from going to traditional birth attendance. It's
It's our culture.
Yes,
It's our culture.
and it's beyond us. So we just find a way to integrate them into this system, and that's what we've been doing. And yes, it's been a success so far.
Okay, I want you to address the fears of side effects. Most times, these vaccines, there are side effects. Even with the routine immunizations, baby has temperature and all that. So with this vaccine that is going to, this vaccination campaign that is coming up, what are you doing to, calm down the fears of side effects?
I want to talk about my own side effects when I had, when I had the COVID
a lot of people
vaccine.
Yes.
I had, very bad headache and high temperature.
So what are some of the things that we should look out for?
So
how can we
with
handle
side effects, side effects are normal occurrences. The way I would react to something is different from the way you would. If you ate shrimp now, somebody could come up with swollen eyes and everything, and I would eat the shrimp and there's absolutely nothing. But then, does that say everybody's not going to eat shrimp? No. And most times you won't know until you've actually tried it. And so, if you do come up, because we know there might be side effects, it's not the whole population that's going to have that. We are already prepared. We have what we call adverse reactions. Our staff are prepared, they know, because we always document every side effect. So we're very meticulous. We want to know which side effects came up, when it came up, and then of course there are treatments for that. And most times, even when we're educating, we let caregivers know that there may be, they could, just like when you took COVID. When I took it, my hand felt so heavy, I was like, oh wow, and then within a few days it resolved. So there could be minor side effects like the headache, just feeling tired and all. And that's why we prep caregivers ahead to anticipate that. But if there are very, side effects that are really concerning, the temperature is really high, you need to come to the primary healthcare center. You need to see a trained healthcare provider, because then of course we're going to give you the paracetamol, different things, depending on the side effects the symptoms that the child has. And so we treat, we monitor, and we ensure that even if it's a complicated one, even the general hospitals are in this with this for us. And all this treatment, because the vaccine is free, even the treatment, you get it free as well. So again, I'm not going to discard something because one or two people might get a reaction, because that reaction is anticipated, that one or two. We're all different. Our DNA is different. The way we react, you could react to an accident like, oh, sorry. And someone will be like, it's all different. But then we're prepared, and we're telling caregivers that if there are side effects, please do not hesitate to call in, to come to the PHC. Don't even say, oh, it's a minor one. It's better to come in and we reassure you that it's a minor one. And then, of course, whatever treatment we're going to give you, we give you, and we follow up to ensure that your child is safe at all times, even for the adults as well.
Okay, can any of the immunization vaccines be too much for ages 0 to 5?
No, not 0 to 5, 0 to 59.
0 to 59, okay.
0 to 59. So, no. In fact, when you see a missed child that is still under 23 months for routine immunization, that's a child that has not been immunized before, you are advised to vaccinate that child with all due antigens. Reason? Yes, reason. You might still miss that child if you don't catch that child at that moment.
Maybe the mother traveled and was not able to get that child vaccinated. How sure are you that she's going to make the next appointment that you give? So
If you
yes,
miss it,
yes,
Catch up.
yes, and these children are under 5 years. They're susceptible. They go to schools, they touch themselves, especially for measles. They touch themselves, they put things in their mouth, you know, and, you know, measles is contagious. So any child you see that is not vaccinated, that has never been vaccinated, and that is under the age of 23 months, we give all antigens due.
so the vaccination exercise, does it come at a cost? The mobile vaccinators, are they allowed to take cash money for payment? Free.
It's free.
Okay.
The vaccination is free. If anyone asks you for money, please know that is not permissible. Our healthcare workers know, and I do not anticipate that any healthcare worker would be requesting for payment for this. It is absolutely free. It is provided courtesy the federal government of Nigeria, and also the state government of Lagos State is providing as well, even the consumables, down to the gloves, to the needles, everything that is going to be utilized. So nobody should have to pay, or nobody is to pay for anything. Absolutely.
Okay, when you spoke about consent forms, you know, for schools, and she said it's not compulsory. So are schools trained, you know, to respect such decisions on consent forms?
Oh, yes. As you know, on the consent form, it will say, do you yes or no? And so if a parent puts no, the school will naturally, even the healthcare worker, the school is expected to separate those whose parents have said no from those whose parents have said yes. And so the healthcare worker will be immunizing, vaccinating only those who have said yes. That's what we expect the school to do for us. And also we're going to look at the consent form as well, because we need to cite it to be sure that, yes, this is, because you know, somebody could have looked and thought the names are similar. It's always good to double check as well. But then, like we said, we encourage every parent. Honestly, if I knew every PTA meeting, I would go there, because I have a child as well, and my mom goes, should they immunize? I'm like, yes, Mom, they should immunize her, because it's better to be safe than to be sorry. These children, like Mrs. Oshodi said, my daughter's, ever since she started school, she wasn't sick before, but now it's like runny nose all the time. She sneezes, and then she goes to touch her
She's
friend.
going through that now.
Yes, and then they hug, they kiss. Am I going to say, oh, please don't let her sit near, don't let her touch, don't let? I'm sure, I can't imagine how many times you've gone to the clinic because of one thing or the other, cough, cold. But you see,
well now.
they're minor, because I don't get so worried, because I know how vaccinations is up to date, down to even vitamin A and all, because we forget that there's so many things that goes into this, and we're looking to protect them, to protect their health, and to ensure that their immunity is built up to be able to fight any other thing that comes in. And so I feel more comfortable to be able to tell another parent, please let your child be vaccinated. It's as simple as that, because the consequences of not getting vaccinated, when I used to work at the General Hospital, when you see the consequences, it's disheartening. When a mother is crying and you know this could have been prevented. And so as a healthcare worker taxed with encouraging people, taxed with making sure people are healthy, I start to feel like, where did we miss the ball? What could I have done better to have informed this mother, to have taken this, because she wouldn't be here if this had not.
I'll still go back to hesitancy. For your mobile vaccinators, how equipped are they when they encounter parents who are hesitant about it?
Okay, so we have the vaccinators, and we have a vaccinator, one that is also the team supervisor, and there's a special training for the team supervisors, and we expect that they are able to pass this information, accurate information. We expect that they know about the disease condition itself, the prevention, and they also know about the vaccines that they're administering. It's not just about going into the community and administering vaccines to the community members.
People will
So
ask
you
you
have to be-
questions.
Yeah, sure. That has happened to
Yeah.
me before while I was supervising, and I mean, I was able to come up with facts. So you could go into the community, and if you don't have facts, I mean, you're already defeated. So we equip them with facts about the vaccine, about the disease condition, and we expect them to be able to also translate that to the community members.
I want to digress a bit. Doctor, is it a myth, or is it a normal symptom for a child who is teething to be feverish, to have this feverish
Eruption.
conditions? Yeah, malaria.
No, it's not a myth. The thing is, remember that if you're teething, the teeth wants to come out. It's like you're busting up because they've had gums, and now this little organ teeth is busting out. So different reactions as it opens up. You could have some slight symptoms of inflammation. Yes, that area is hot, is reddish and all, which is fine. But normally, all you just need is, if there's temperature, bit of paracetamol will work, and that's it. Because really, the baby, it's a normal reaction that is anticipated. I know people will go teething powder, this, that.
That's a new mother too.
And sometimes the baby stools.
Now, see, baby
Diarrhea.
stools,
No.
that I would love to know. There are questions that need to be asked. If you're breastfeeding, I don't even expect that in a child that is being breastfed. But if you're using baby formula, if you're using, what do you call it, the feeding bottles. Now, it's not that feeding bottles are bad. The problem is the maker said you must disinfect.
Yeah.
You must have the whole set, the minty, everything, and put it in there for at least 8 to 12 hours because the teeth it has to break down. Now, we put it in there. I have 2 feeding bottles. I'm recycling.
Yeah.
Remember, it's 1 feeding bottle per feed, and then it goes for 8 to 12 hours. But now you've recycled the bacteria for the food that sticks to the teeth of that feeding bottle. The bacteria know, and they go eating it. And then you now use it for your baby. Indirectly, you've given your baby what? Bacteria to eat as well. And that's why we know when you come and we start seeing that baby being bottle fed that is having diarrhea, we know it's because of hygiene. It's 1 feeding bottle per feed. So if you're going to do feeding bottle, you need to have, a baby is going to be fed every 2 hours. You need to have 8 to 12 feeding bottles. How many of us do that in Nigeria? So we don't have that. So we encourage having like a silver cup, and you're using the spoon
That's what I
because
would
you can
prefer.
see it. It's clean.
Yeah.
And then you wash it, pop, you're done. We don't, everything, it's not everything that comes from abroad that is always, we have to look at our own context and our own culture and look at what is suitable. So the cup is cheap. You don't need electricity to sterilize it. You wash it, you turn it
soap and
upside down,
water.
soap and water, and that's it. Whereas if you're using the feeding bottle, you need to have the
sterilizer.
quantity. You need to have electricity. You need to sterilize it and adhere to the manufacturer's recommendation.
Okay, Kevin. There was this fact. Should I still call this a myth or another misconception? Mumps, rubella. I didn't see it as part of the scheduled vaccines for immunization. And then when I had my kids, it was very, very important. And because they said, if you don't give it to your sons, they will go impotent. That's what I'm asking. Is this another myth or a misconception? The mumps and rubella. It's been a while. I can't remember. Vaccines, yes.
That should be a myth.
Okay.
I mean, okay, so you know that this mumps and rubella vaccines are available at the private facilities because it's not available at the primary healthcare facilities. However, after this campaign, we're looking at, I think National is looking at introducing measles rubella vaccine next year. So we're hopeful and we pray that this campaign will be a success, and then by next year we get our measles and rubella vaccine. But that's a myth.
That's it. I was really worried that I was particular about that particular vaccine for my sons. So I'd like you to leave us the last word.
So I am appealing to every caregiver. As a mom myself, I need for us to allow our children to get this vaccine, to get vaccinated, because what we're doing is for vaccine preventable diseases. And whether we like it or not, this disease is abound. So the onus is on us to make the right informed decisions. I'm appealing to adults as well, because this is the first campaign we're doing that it's not just children, we're doing adults as well. So we're going to be vaccinating adults for yellow fever. If you're between 0 to 44 years, please, when we come to your doorstep, when we come to the banks, when we come to the schools, when we go to the companies, when we come to LTV8, when we come to all the ministries everywhere, please, please be kind to our healthcare workers and let them do their job. If you do decide that you don't want it, of course we're going to respect your human rights, and yes, but for the schools, please, please help us send the consent forms home so that the parents have enough time to make their decision and send it back. For the gated estates, we are pleading, please open your gates. We're here for you. The onus is on us to ensure that we help every Lagosian, everyone, to stay healthy. Because if one person is not healthy, it can actually affect the whole community. And that's why we need the herd community with the herd immunization to make sure that every one of us is protected. Thank you.
All right. And Oluwakemi, as a state immunization officer.
Okay, so thank you. My people. Yes, because we're Lagosians.
Yeah, Lagosians.
Yes, we have to just address our people.
Yeah.
So please, when our people come into the community, we've had cases where dogs have been released on our implementers. That's not fair. No is no, and that is fine. We're not forcing anybody to get vaccinated. It's voluntary, and we've gotten feedbacks from some of the schools that they want their children immunized at a healthcare facility. Just saying it is not enough. Get your children vaccinated at the health facilities, as you have indicated. So we are appealing to everyone in Lagos State. We need to build a better Lagos, a healthy Lagos. Thank you.
If I may say something. To go another route, Iyasilifa. Daddy Khalif, ẹjọ́, à ń bẹ̀ yín ni. Tá bá ti wá, ẹ má sọ pé ẹ gbà, ẹjọ́. Ẹ bi wá ìbéèrè kí ìbéèrè tẹ́ bá fẹ́ béèrè. Nǹkan tí ò bá yé yín, àwọn èèyàn wa wá sọ fún yín. Ṣùgbọ́n ẹjọ́ nítorí àwọn ọmọ wa, àwọn ọ̀la wa, nítorí ẹ̀ la fi ń ṣe eléyìí. Ẹjọ́ o, ẹ jẹ́ káwọn ọmọ wa gba vaccine wọn o. Ẹ ṣé gan ni.
Thank you.
All right.
I'm stunned.
She speaks so well.
I speak Yoruba so well and English very well too.
All right. Vaccination saves lives, and I hope you've learned a thing or two from today's conversation. Thank you so much.
Immunization days
Yes,
from October 19th to November 2nd,
yes.
2024.
Please take advantage of this. I thank you very much, Oluwakemi Oshodi, State Immunization Officer. Thank you so much. And Dr. Iwayemi Ayovon, Deputy Director, Medical Services and Disease Control. Thank you so much. The conversation continues after this. Stay with us.